the dilemma that surgeons face or patients face is when it is silent, what do you do?
Correct.
So this whole discussion is because this is a very common presentation in our clinical practice. Most of the patients with gallstones are silent gallstones. That is predominantly the majority of the people who come with a ultrasound report with a gallstone. Then what do you do?
You are watching Surgery Simplified. शस्त्रकला सरल शब्दों में.
हेलो, वेलकम बैक टू आवर चैनल सर्जरी सिंप्लीफाइड, शस्त्रकला सरल शब्दों में. मेरे साथ है डॉक्टर निखिल.
नमस्ते.
सो डॉक्टर, पिछले एपिसोड में वी स्पोक अबाउट गॉल ब्लैडर डिजीज विच कैन बी क्योर्ड विद मेडिकेशन एंड केयर. यू ऑल्सो स्पोक अबाउट कि थोड़े से कैंसरस वाले भी कंडीशंस हैं.
So basically last time what we spoke was gallstones causing chronic abdominal pain,
Right.
which is the more common presentation, and those gallstones which do not have any symptoms called silent gallstones, and how do we approach it?
Right.
Now the most important reason why we want to treat a gallstone which is silent, not causing any symptoms, is of course because it can lead to repeated infection and some symptoms, but more important than that is the chance that it may develop cancer. Now, if you take gallbladder cancer, it is one of the fourth most frequent cancers in India. And after breast cancer and uterus cancer in females, the next most common cancer in ladies is gallbladder cancer. Since gallbladder disease is more common in ladies compared to gents, so it becomes important that we understand which are those ladies with gallbladder stone or even males who may go towards cancer. How do you understand that the disease is shifting from non-cancer to cancer, and then what is the treatment and what is the diagnosis?
Sure.
So, which are the signs that a gallstone which was earlier not cancerous is now leading into cancer? So, the first thing is the age. Those ladies who are above 40, 45, 50, you can assume that the gallstone has remained in her for a longer period of time. So suppose you find a silent gallstone in an older lady. Second, if the gallstone is big, because to reach a size of 2.5 centimeters or more, it takes a longer period of time. Third, as we said, that if the patient symptom has changed, if the pain which was coming off and on or it was mild pain has now become more severe and more continuous. Fourth, the most important, if the patient has developed jaundice. Okay, so this is clinically. On ultrasound, what you can find is that the thickness of the wall of the gallbladder. Suppose the gallstone is there and there is no symptom, and for whatever reason patient doesn't want to get operated. So you tell them that you get ultrasound every 3 months, 4 months. That is known as keeping it under surveillance. So let us say after 1 or 2 ultrasound examinations, say 6 months down the line, you find that compared to the earlier, now the gallbladder wall is showing thickening. That could be the reason to abort surveillance and go for surgery.
Okay.
And of course, in some cases, as I said, porcelain gallbladder, where it is like a white, thick gallbladder, completely white because there is calcium in that, or if there are polyps inside. All these people are candidates for developing cancer of the gallbladder. Now, what is the importance or what is the danger of gallbladder? See, the gallbladder is stuck to the undersurface of the liver.
Right.
Liver is a very important organ, and therefore, whenever it develops, gallbladder develops into a cancer, it very quickly spreads into the liver. And therefore, if it is not treated early, then it soon becomes untreatable. That means it goes into the liver and spreads. And because the liver is very vascular, the spread of the cancer can go very fast into other parts of the abdomen and other parts of the body. Hence, it needs to be treated fast. So, what are the stages of the cancer? Stage 1 is you've done a gallbladder and later on the report came that it is cancer.
Acha.
Okay, so that doesn't need anything more than just keeping a watch because they already removed the gallbladder. Then the second stage is gallbladder. Some part of the gallbladder has a cancer, but it is restricted to the gallbladder. Okay. In these cases, what you need to do along with the gallbladder, you need to remove a portion of the liver, at least 2 centimeters where the liver is. That much liver has to be removed. The third stage is where already it has become a solid mass. The gallbladder has become a solid mass. It is already showing cancer. Now that is expected to have spread into the liver. Over here, what you need to do is you have to remove at least the right part of the liver along with the gallbladder. And the last stage is where it is already spread. Even there, what we call as palliative surgery is done. That means because the gallbladder has become a cancerous mass, it tends to go into the bile tubes, the tubes which bring the bile down into the liver. So the patient develops jaundice. Now to treat that, because jaundice is very irritating, it creates a lot of problem. They get a lot of itching, they become yellow, they don't get appetite. So to improve quality of life, you can remove the right side of the liver and attach the intestine directly to that part of the liver, so that the bile will directly drain into the intestine. So it is known as hepatico-jejunostomy, jejunum being the intestine, which is taken up to the liver. The part of the liver with the gallbladder is removed. Here we are not attempting cure, but we are treating the symptom of jaundice, pain and itching, which the patients have. So we are doing the surgery for that. Regarding the diagnosis, as I said, first is ultrasound. Second, you can do what is known as a contrast CT, which will display the gallbladder in more detail to know whether it is turning into a cancerous gallbladder. And the most important is MRCP, that is magnetic resonance cholangiopancreatography. That means you put a dye which goes into the liver and the gallbladder and the bile ducts and do an MRI. That is also very accurate. And the treatment, as I said, is surgery. Now, unlike other cancers, there is very little role of radiation or chemotherapy in cancerous gallbladder. Regarding survival, if it is only restricted to the gallbladder and you have removed and incidentally it came as cancer, survival of more than 80%, 5-year survival. If it has affected the gallbladder and it was diagnosed before, it was diagnosed as a cancer, then you operated, removing a part of the liver along with that. Even there, in the stage 2 and 1, the survival is quite good, in the range high 60-70% 5-year survival. But as soon as it becomes bigger and goes into the liver and it becomes a big mass, then the prognosis is not very good. There's less than 10% 5-year survival. And also for the spread. So the main problem is that the gallbladder stone remaining in the gallbladder causes changes in the gallbladder by irritating it and causes the cancer. So it takes some time, but unfortunately this disease doesn't present in the initial period with pain because it's a silent gallstone.
Correct.
So that is the reason why the overall prognosis is less. But the corollary is, if you find a patient with silent gallstone, then either you offer surgery if there is a sign that, as I said, a large stone, polyp, thick walled, any of these signs, or advise them continuous surveillance. So at the earliest sign of change on the ultrasound, you can go ahead and do surgery. So this is about cancer of the gallbladder. It is a disease which needs to be treated aggressively whenever you diagnose it. That is the only chance of survival.
One quick question, doctor. You said कि silent जो रहता है gallbladder, it doesn't give you any symptom unless otherwise you go to do an ultrasound for some other particular purpose. अगर ऐसा होता ही नहीं है, so what happens to the patient?
Then they'll develop symptoms of advanced cancer like jaundice, pain, and at that time it will be diagnosed.
Okay. And that again comes at a very later stage.
Yeah, so since this whole thing presents as silent gallstone and then goes into symptoms, the dilemma that surgeons face or patients face is, when it is silent, what do you do?
Correct.
So this whole discussion is because this is a very common presentation in our clinical practice. Most of the patients with gallstones are silent gallstones. That is predominantly the majority of the people who come with a ultrasound report with a gallstone. Then what do you do? So there you have to take into consideration, if the person is younger, directly operate. Patient even older, fit for surgery, operate. Only if the patient is not fit, he has diabetes, blood pressure, heart problem, this, that and other risk for surgery, you keep under surveillance. That is the basic take home message, that silent gallstones should be operated because they are not going to go away. They are only going to cause problem. So where you cannot operate and you want to treat, you can treat with medicines. I told you uracil acid, or you can use lithotripsy to break the stone so that it comes there, and you can do an ERCP and put a stent so that while the powder of the stone falls out, it will not obstruct the bile duct. So you can do an ERCP, put in an endoscope, go there, put a stent in the common bile duct, and then go for breaking the stone. Both these procedures don't need anesthesia.
Okay.
So if suppose you want to treat the stone, but you don't want to do gallbladder because the patient is not a good risk for surgery. In that case, that option is available, but the stone will recur. But at least once the stone is removed, then the irritation of the gallbladder and conversion into malignancy will be stopped.
Correct.
That is the thing.
All right, wonderful. Thank you so much, doctor. So yet another informative episode on gallbladder disease, which is malignant, which is cancerous. So if you have any queries regarding this episode, let us know in the comment section below. Please subscribe our channel, like the video, share, and stay tuned for more such videos. Thank you.